When you don't know what's wrong with you, people see me and they think, oh, you're looking well. And you want to say, well, I might be looking well, but I'm not. I'm anxious, I'm worried. You don't want to go out because you don't know, is today the day I'm going to fall?
Well, Margaret's story is very interesting. She, on a couple of occasions, actually lost consciousness and injured herself. So she broke her ribs, she broke a collarbone on one occasion. And her symptoms didn't really fit with a typical faint in that she got very little, if no warning, before suddenly losing consciousness.
One day I was just sitting on the chair talking to a friend, and next thing I know, I was on the floor and she was trying to, get me up. When I went to the hospital, they said that I'd broken my right clavicle. No idea what happened.
She lost a lot of confidence, so she was really very scared about leaving the house on her own, and it's really restricted what she's been doing with her life recently.
What was important for me was finding out what the problem was. Finding out what the problem was and then looking for a cure. Dr. Long was very much, let's find out what's wrong and then we can take it from there.
So if somebody's having very frequent symptoms, they're dizzy several times a day, then we can usually make a diagnosis using some sort of simple heart monitor. But if a patient's symptoms are intermittent, long gaps between them, then you're just not going to be able to pick up, make the diagnosis. That's when we turn to a LINQ.
The LINQ implantation technique itself allows us to implant very, very quickly, but without sort of making big incisions into a patient's skin. So it's really, really simple. It allows us to do it outside of a lab environment, which is a massive sort of time and efficiency saving. So patients can come in and within 40 minutes they leave with their device.
Once I got the LINQ in, I actually thought, right, okay, I've got this now. The hospital can monitor me. It reassured me, and because I was reassured and I was able to relax, I went out. I didn't stay around, I went into central London by myself.
The arrhythmia that we've picked up will come through to us virtually, so the patient will be at home, we will be in work, and we'll pick it up. We'll see the arrhythmia, we'll call the patient, see if they're okay, tell them what we found, say that we're going to talk to a doctor. If they're sick, we'll bring them straight in. We'll go and see a doctor, get that reviewed, and they'll make a management plan. So then we'll have a device inserted or medication review or whatever's necessary.
The hospital phoned me and said that they've picked up on my heart without me knowing. So they said, right, that's definitely, they're putting me forward for a pacemaker. When you want to know what's wrong and nobody seems to be able to tell you what's wrong, and then they say, we found out what's wrong. My husband was terrified. He goes, your heart stopped for 12 seconds. And I said, yes, but now they know what's wrong. Now we can do something about it. I got confident again. I became independent again.